Guys, today I'm discussing one of the topic of the respiratory physiology, that is oxygen hemoglobin dissociation curve. As we all know that oxygen is carried in the blood in two forms, dissolved form and bind with hemoglobin, right? If every hemoglobin has polypeptide subunit that contain 2 alpha and 2 beta subunits, right? Hemoglobin has 4 heme groups that has to bind oxygen. 4 oxygen molecule can bind to 1 hemoglobin molecule. As this is the normal hemoglobin that is present in the adult, while the hemoglobin present in the fetal that has 2 alpha groups and 2 gamma group. It has the more affinity for oxygen to bind. Right now I am here going to draw the oxygen hemoglobin dissociation curve, and I'll tell you it's very easy to remember this curve. It's a sigmoid shaped curve, right? It's a sigmoid shaped curve. If it's deviated right, this is how it deviated to the left. This is the oxygen and this is the hemoglobin saturation rate, right? Here we have 25, then we have 50, and then we have 75, then we have 100. Here we have this is 50 and this is 100, right? This is hemoglobin side. It shifts to the right and shifts to the left, right? When it shifts to the right occurs when there is an affinity of the oxygen is decreased, right? This is oxygen now. When it shifts to the right, this is the decreased affinity towards the oxygen. When shift to the left, it is the increased affinity towards oxygen, right? Remember, when it is the oxygen is 100%, hemoglobin is 100% saturated. Both 100%, both are saturated. It means all the heme groups of hemoglobin has oxygen with it, right? And when it is 40% saturated, 40% hemoglobin oxygen, then it is 75% saturated, right? This is 40% saturated. It means that 3 or 4 heme groups, when it is 40% saturated, it is 75. This is the hemoglobin, only 3 of it have oxygen, right? When it is 75%, it means it has almost all 4 oxygen bounded, right? This is all the oxygen hemoglobin. Now there is a mnemonic, or there is an easy way how you remember that it is shifting to the right and it is shifting to the left. This is partial oxygen, this is hemoglobin. Now it is shifting to the right, decrease affinity for oxygen. Remember, everything are increasing, only one is decreasing. This is the mnemonic DPT. They all are increasing. D is for 2, 3, D, GP, that is the fetal hemoglobin, and P is the partial pressure of carbon dioxide. It is also increasing. When the partial carbon dioxide is increased, it has a decreased affinity for oxygen and hemoglobin bound to carbon dioxide. And there is a temperature increase. Increased temperature at high altitudes, oxygen is not readily available, and pH is decreasing. It is acidosis. So it's very easy to remember. This is for the right shift, right? For the right shift, it is decreased pH and increased partial carbon dioxide, increased temperature, and increased 2, 3 DGP, right? When it shifts to the left, it is opposite of it. Increase in pH and decrease in partial carbon dioxide, decrease in temperature, and decrease in 2, 3 DGP, right? This is a very easy way to remember the oxygen hemoglobin dissociation curve. The mnemonic is DPT. It is increasing in the right and DPT is decreasing in the left. This is all for today. If you guys like my video, do subscribe my channel. Thank you.